And it is tricky because it's like, what is a normal amount? Like, what should
Yeah.
we be eating? That varies person to person, right? Like an adolescent who plays three sports and is going through puberty has to eat a
Hmm.
lot of food to be able to maintain their caloric intake adequately, right? Versus maybe like a more sedentary adult has different calorie needs. And even day to day, our needs are different. So, what you ate yesterday versus today, your needs could be different. So your hunger may be different because your needs were different. And that doesn't mean that you overate today because you ate more than yesterday, right? So it is tricky. I think the key thing here is the loss of control, that feeling of loss of control.
Hmm.
Some people will report to me like, I don't even remember doing it. I'm finding empty packages, or like I completely black out while it's happening. I'm not even aware what's happening. And so I think it's that loss of control piece that's
Hmm.
really important. But the other thing that I think is really tricky and also often gets missed is there is this binge restrict cycle that happens. So if
Hmm.
someone say, if you're a part of that 30 to 40% of people seeking weight loss treatment, right, and you want to lose weight, so you restrict your intake. Say you drastically cut your calories because someone on TikTok told you to do that.
Hmm.
Now you're starving, you're hungry. And so then you eat a lot at night because you've been restricting yourself all day when you really needed those calories to be able to function. Well, was that binge a result of binge eating disorder, or was it a result of a restrictive eating disorder that now your body is like biologically forcing you to compensate for? And so I think even the categorization of eating disorders, it's not clear cut. And I think when you're seeing an individual patient, it almost doesn't matter
Yeah.
which eating
Yeah.
disorder they have,
Hmm.
because that symptomatology can also change over time. But I think what matters is there's psychological things going on that are affecting this person's relationship with food and their body,
Hmm.
and that's important to address. And this person has whatever health conditions they have, and that's important to address. And we need to make sure they're meeting their nutritional needs and that we are addressing whatever psychological issues are underlying that are contributing to that as well, and
Hmm.
any environmental factors as well. Because I think the other thing is that people don't realize there's a very strong genetic component to eating disorders.
Oh,
It
interesting.
is there's a genetic predisposition, there's environmental factors that contribute, and then there's biological factors that contribute, and there's some trigger that happens to a person that flips the switch generally, and it happens.
Mm.
And so it's a lot of different pieces that you're going to be addressing. It's not all one thing.
Mhm.
But again, it doesn't really matter which of these things we're dealing with as long as we're addressing all of those person's needs. The label is the label for coding purposes. It's more
Right.
important to just address what that patient needs.